Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the purpose of this broadcast is just to share a few comments about vitamin D, particularly as we approach the flu season this year. And I had multiple conversations today about vitamin D, probably at least 7 or 8 with patients that were quite more detailed than usual. So I thought I would just pass on some ideas that might refresh this in your mind. First of all, vitamin D at high dose has been shown in different research to significantly decrease risk of viral infections in general and influenza specifically. Now, the research that shows benefit actually shows the greatest benefit for people that are the most deficient. And so if you're not currently taking any kind of vitamin D supplementation at this time, the chances are that you're substantially deficient unless you've been spending a lot of time in the sun, which of course most people haven't been, especially this time of the year. So the people who were regularly taking vitamin D had some benefit, some additional benefit if they upped the dose. So there is additional evidence that shows improved immune function when you push your vitamin D levels up to the high normal range. So what does that mean in terms of the high normal range? Well, for the average person, just to be into the mid-normal range, they need to be taking 5,000 units of vitamin D a day. Now, there's a tiny percentage of people where that's going to turn out to be too much. But for most people, that puts them right about in the middle. It puts a few people into the high range. But for most people to be in the high range, they're going to need to be taking closer to 7,000 or 8,000 units a day. Now, there's interestingly some additional information that shows very powerful breast cancer reduction risk for women who are in the high normal range. This research released not too long ago, but again, we're focusing on influenza today. And there isn't any published research that I could come across that looked at what do you do when you combine vitamin D and influenza immunization. And as far as I know, nobody knows. We don't know if it makes it better, makes it worse. We don't know if vitamin D supplementation is more effective than influenza vaccine, assuming that you give the benefit of the doubt that influenza vaccines are as effective as they claim to be. Now, there are, as you probably know, a lot of people that claim that there is no effectiveness for influenza vaccines. All I can say is that the research, unfortunately, is inconclusive. If you look at all of the stuff that's out there, the most non-biased group of people that look at this are the Cochrane Collaborative, and on their database, they look at medical studies as carefully as they can, and so they do see some benefit with influenza injections, influenza vaccinations, but it's very, very modest according to their review of the information. And in some situations, there's no benefit at all. You can go look at the Cochrane databases yourself and draw your own conclusions there. But the point is, we just don't know which is better, flu shots or vitamin D supplementation. But the vitamin D supplementation research is actually considered robust and also considered highly reliable research. In other words, it was well done. So I think we can trust it. So the take-home message is take at least 5,000 units of vitamin D a day. Now, you're going to read, if you go online, that the government recommends well less than that, well less than 1,000 units a day. And there's even a place where a prestigious medical group says no more than 4,000 units a day. And in my own research, monitoring people's blood levels, that gets you, those kind of goals of intake get you into below normal ranges, especially if it's less than 1,000 units a day. I can guarantee you that you're going to be deficient. So 4,000 units will get some people into a good range. 5,000 units, a higher chance. And so the second question, though, is there something else I should be doing if I'm doing vitamin D? And the answer is yes, you should, because when you start supplementing vitamin D, you fix a problem that the body had when you were deficient, which is that it wasn't absorbing calcium very well from the food that you're eating. And so once you fix your vitamin D deficiency, all of a sudden you're getting lots of calcium into the body. And so the body doesn't know what to do with that calcium if you're deficient in another vitamin, which is called vitamin K2. And vitamin K2 has multiple subtypes to make it even more interesting. Well, my recommendations for my patients are, unless I know that they're consuming a high vitamin K2 diet, that they routinely supplement with vitamin K2 so that the body is getting the proper signals of where to store that calcium that's now coming into the body at a much more efficient level. And so that's something to keep in mind, getting enough vitamin K2. I cover that in other information, other sources. But take-home messages for today is don't forget the vitamin D when it comes to avoiding or minimizing, decreasing your risk for viral infections of all type and influenza specifically. I wish you all, God bless, a healthy winter, and talk to you later.